Hello, my name is Aran Centreado and I'm going to talk about renal complication of hematopoietic cell transplantation. Definition: transplanted of hematopoietic stem cells is the infusion of hematopoietic progenitor cells in the patient with hematologic malignant, non-malignant, acquired, and genetic disorders of the bone marrow to reestablish immune and marrow function, as a result of the use of total body irradiation and/or chemotherapeutic agents. Renal dysfunction often ensues.
The human body contains organs such as bones, the brain, heart, and reproductive organs. The basic cells that give rise to all of the different cells in these organs are called stem cells. One type of stem cell is an egg cell from a woman that has been fertilized by a sperm from a man. This single cell, called a zygote, is the first cell in a developing human being. It's also called a totipotent stem cell because it can form any type of cell in the body, as well as the umbilical cord and placenta. After a zygote has divided a few times, it becomes an early-stage embryo called a blastocyst. Embryonic stem cells come from the cells inside the blastocyst. Embryonic stem cells are pluripotent. This means they can form any cell in the body, but not the cells in the umbilical cord or placenta. In the lab, embryonic stem cells are donated from leftover embryos created during in vitro fertilization. In vitro fertilization is a procedure to help a woman become pregnant. Another type of stem cell is an adult stem cell. Small groups of these cells are found in some organs, such as the skin, after birth and into adulthood. Adult stem cells are multipotent. This means they can only become a few different cell types related to the organ where they're found. For example, the skin contains a small number of adult stem cells that can divide to create new skin adult stem cells. Or they can become more specialized skin cells to replace those that are lost due to cell aging or damage. In the lab, scientists can now induce or cause a regular body cell, such as a skin cell, to change into a pluripotent stem cell. Like embryonic stem cells, these induced pluripotent stem cells can become any type of cell in the body. Scientists study stem cells to learn how and why they become many different types of cells. In the future, these cells may be used to regrow tissues and organs that have been damaged by injury or disease. To treat a disease or condition. Currently, stem cell therapy only treats diseases and cancers of the blood. In leukemia, for example, the patient's bone marrow makes many abnormal white blood cells that can't do their job to fight infection. Over time, these abnormal cells crowd out the production of healthy white blood cells. In stem cell therapy for leukemia, called hematopoietic stem cell transplantation, a doctor will take a sample of blood or bone marrow from the patient or a donor. In some cases, donor blood may come from a baby's umbilical cord after it's born. These tissue samples contain healthy hematopoietic or blood-forming stem cells. Then, doctors will give the patient chemotherapy drugs or use radiation to kill the abnormal white blood cells and their stem cells. Once the abnormal cells are gone, the doctor will transplant the healthy hematopoietic stem cells from the tissue samples into the patient. These healthy stem cells will make new blood cells, including normal white blood cells, which will allow the body to fight off infections.
Applications in medicine. A wide spectrum of renal diseases could be classified into four categories: complications related to hematopoietic cell transplantation, conditioning regimen, immunosuppression, or post-transplantation complications, podocytopathy, membranous nephropathy, recurrence or persistence of original hematologic disease.
So, hematopoietic stem cells, also known as bone marrow stem cells, are recently discovered cells that have revolutionized treatment of diseases and brought the world into a new age of realistic compatibilities and solutions. In the following video, the biotechnology of these miracle cells, as many call them, will be presented and explained. So let's talk about stem cells in general before we get into hematopoietic stem cells. So stem cells are very different from almost every other cell. Stem cells are unspecialized cells, while most cells are specialized for a unique job. Let's look at an example to see how this works. So we have red blood cells. Now they're specialized and have the important job of carrying oxygen throughout the circulatory system. These red blood cells have some of their genes turned off because they don't need to use them. One of the genes that they have turned off is the gene to grow hair. You don't want hairy blood cells, nor do you need it, so that gene is turned off. With an adult stem cell, all the genes are turned on, but only for a specific type of organ or tissue, and they serve no specific function but to turn into specialized cells when the body needs them. So for instance, if the body needs to repair liver tissue, stem cells will be cued by the body to turn into that specific cell type. So that was stem cells. So now this is hematopoietic stem cells, or HSCs, and they're a specific type of stem cell. They're formed during the embryonic development like most cells, but they can only be found in bone marrow and umbilical cord blood as an adult.
Pros and cons. Pros. It doesn't have chronic syndrome, nephrotoxicity, glomerular disease after HSCT, HSCT-associated thrombotic microangiopathy. Issue applied in Ecuador. Chronic disease occurs in 20 to 60% of HSCT patients and has been associated with the use of radiation and or chemotherapeutic agents, acute and chronic graft versus host disease, and acute renal failure. A range of glomerular injury progress such as membranous nephropathy and minimal change disease has been observed in the setting of HCT, primarily as individual case reports. Acute kidney injury occurs in approximately 50% of patients following hematopoietic cell transplantation. The incidence rate is the highest after myeloablative allogenic HCT and lowest after autologous HCT. Dime que salió un video donde salió y lo voy a dejar.
After being sick with flu-like symptoms in August of this past year, I went to the doctor and was diagnosed with leukemia the same day and admitted. Was told at the time that I had untreated 10 days to live.
I was diagnosed with myeloid-dysplasty syndrome back in September 2010. Went to chemo at another hospital for a year before I transferred here and went through the stem cell transplant.
I signed up, of course, quickly for as much chemo and everything that I could get to give me a better chance at life, and quickly it became known to me that my best chance would be a stem cell transplant. I didn't have any siblings who matched, and so they found a 100% match with an unrelated donor. I don't know anything about the person other than it's a male, and after a year, then we'll get to find out about each other. But right now, I just know I have a male's DNA.
There's mental healing, physical healing, and right now I'm in the physical part of it where I'm getting my body back the way it was. I've been out of work for almost 2 years now because of this, so getting back in shape and getting back in the landscape, and this is helping.
I'm not a good person to exercise, and I really kind of regretted it when the nurse practitioners and the physicians were pushing me to get into the physical therapy program at Diane for stem cell transplant recipients. I didn't see it as an option. I was afraid to do it because I've not been an exercise person, but that way when they say, "Are you exercising?" I can say, "Yes, I'm going to the Diane Center."
At first it's going to be hard, but don't give up. Never give up. Keep going. First couple days my legs hurt like heck, but I kept coming back and working out and working through it. And now I don't feel them no more. So you improve over the weeks. So it's good for you.
Although it's hard to get started and it's really hard after you're finished with an hour and a half, you feel better. And I've seen my strength increase even. And we are on the second floor of the apartments at the Village at Vanderbilt staying for the 100-day duration. And Alan, my husband, has me take the steps, and I've been able to tell a big difference in going up and down the steps just from my 2-day-week experience.
Some days I don't feel like it, but I come anyway. It's good to be here because it's fun. The girls will make you laugh all the time.
Hopefully I'll recover soon and my life will be back to normal. I'll be able to go back to work, and everything that I had done in the past I will be able to do again, and I think this gives me the best opportunity at doing that so that I stay stronger and healthier, and it will ward away some of the things that might cause me to get sicker. And so I'm trying my best to do what the doctors and nurses and even the exercise specialists here say, although it's hard sometimes. I'd gone to physical therapy programs before for a bad back or various other things, and they were hard. And I think everybody expects that to be the case. And I'm not saying this is not hard, but I think it's worthwhile.
Very friendly and
Conclusion: renal complications caused by HSCT are high and are associated with the development of both acute and chronic kidney failure. So, considering the increasing numbers of HSCT survivors many years after the transplantation, chronic kidney disease due to HSCT is becoming a growing problem and represents a new population of patients who are presented to nephrologists. The renal biopsy remains essential for diagnosing the underlying injury that can affect one or more compartments of the kidney in this unique clinical setting.
Hello, I'm Harry Jacob. I'm the Chief Medical Editor of HEMONC Today, and delighted to have sitting next to me Dr. Keith Sullivan, who's professor of internal medicine at Duke University and a member of the Division of Cellular Therapy and Bone Marrow Transplantation at Duke. As many of you know, Dr. Sullivan has been one of the real pioneers in bone marrow transplantation, and is going to tell us a bit about the Chinese menu, as he puts it, choices that we now have in providing hematopoietic stem cell therapy to various patients, and how to look at that menu with some rationality in suggesting and advising patients as what kind of therapy is going to be most useful and least toxic for those patients. Keith?
Thanks, Dr. Jacobs. The menu is pretty straightforward. You had pretty much a fixed repertoire of a standard preparatory regimen for transplant. 20 years ago was an ablative regimen. You had a standard type of donor. It was a HLA identical sibling, and you had a standard source of stem cells. It was bone marrow. And transplantation, now many units are calling this actually cellular therapy, has evolved and reinvented itself as new sources of hematopoietic stem cells have become available, as new preparative regimens have become available and established and effective. That has opened up then not only the availability of the technology, but has pushed back areas of what are the diseases that can be approached by this. And so now we have stem cell sources that can be marrow or peripheral blood or umbilical cord blood cells. We have marrow or stem cell sources from siblings or unrelated donors or autologous self donors with manipulated products, or ablative, myeloablative, or reduced intensity, or even now truly non-myeloablative regimens. These then allow us to take the different components, the best match of the regimen of the source of stem cells and the donor of HLA matching that could then be tailored to the patient's disease and age. I think this is important because our population is aging, and the patients that are being considered for malignant diseases are increasing in their age.
Let me ask, how old are patients now that are being provided with bone marrow or stem cell transplantation? I can recall when it was the cutoff of 50 years, or maybe even 45, when you folks first started. Where are we now? How old is a person? How old can a person be and get a transplant? Is that part of your choice of Chinese medicine?
Absolutely. Some have actually joked that as the faculty have aged, the upper limit of age for patients has increased. But I think that we are performing transplants, both autologous